Well, thank you all for joining us. I am Ray Blaylock with Sickle Cell Foundation of Minnesota, and this is Living SickleSMART. We are glad that you joined us today. So whether you're joining us live or you are watching the on-demand replay, we're glad that you're here, and we believe that you're going to get some really good information out of this. This is actually part 2 of a series, but before we begin, I'm going to share my screen just so that I can make sure that you all know who are the people that help make this happen, because that's really important. So I do want to make sure that I give a shout out to Children's Minnesota Sickle Cell Program, as well as Agios and Memorial Blood Centers, Be the Match, and the Sickle Cell Data Collection Program with the Minnesota Department of Health. We are so grateful to our partners and our sponsors who help make this happen. And tonight as I said, we have part 2 of the TheHemeNP. So exciting. If you know anything about the TheHemeNP, I'm telling you, it's like an encyclopedia on Instagram. Right? I mean, every topic you can think of, and it's always presented in a fun way, in a way that's easy to understand, and in a way that makes you want to engage and leave a comment and add your 2 cents. And so we are just thrilled to have her here, and we are honored. Maya, how are you today?
Great. I'm so excited to be here, and thanks for joining in our Let's Talk About Sex 2.0.
I love it. Let's talk about sex. I feel like I should have had like the Salt and Pepper song playing in the background.
Yeah.
That's what I hear in my head. So if we do clips or something, we'll make sure that we'll see if it's free content first. All right. So I'm going to turn it over to you. At the end, I'll join in. We'll have a little bit of a dialogue and ask any questions that might come up. But in the meantime, take it away.
Awesome. So while I share my screen, just a little bit about myself. My name is Maya Bloomberg. I'm a hematology nurse practitioner, and for the last 8 years, I've been working with Dr. Harrington at University of Miami and Jackson Memorial Hospital, and I take care of around 300, almost 350 patients with sickle cell. I also specialize in bleeding disorders, and it just was very shocking, the disparities between 2 very rare conditions, one even more rare that had so many more resources and so many more treatments, that it was very easy to become an advocate and want to help this community. So on tonight's presentation, it's a little different. I feel like my go-to is kind of to talk about topics that aren't always reviewed in a clinic visit. So today, we will be talking about sickle cell and sexual health, because I think when it comes to treating a patient, I always take a holistic approach. There's more than just sickle cell. We really need to talk about the mind, the body, the soul, and sexual health is included in that. So I hope you all learn a little bit from this presentation and just learn how to be a healthier version of yourself. So as with any presentation I give, I always have to open with a disclaimer that I cannot provide any specific medical advice. At the end of the day, you always want to talk to your provider who is very familiar with your history before instituting any new treatments or exercise or health plans. Here's a nice overview of what we're going to be discussing today. So we will talk about first discussing your condition, how to disclose it, and what information to include. We'll then talk about steps for effective communication, moving down to sickle cell with regards to reproductive health, talking about issues of priapism and periods. We'll then talk about how to prevent limitations and insecurities from interfering with your sexual health. And then we will end with alternative methods of intimacy. So when it comes to discussing your condition, having that talk, what do you say? How much do you reveal? We look at the literature and we can see that some people find that disclosing on the first date might not be ideal, while some women like to disclose right away to avoid secrets. Some might be even vocal on social media, so your partner might even know about your condition before you do. But it just gives you some food for thought, how you want to discuss and when you want to discuss. In my opinion, I think it's better to do it earlier before you have a strong emotional connection, because for some people, when they find out, it might be a deal breaker. And honestly, if that's the case, you want to do better. I always say that my partners who are really in relationships and they come to the appointments, they want to learn about the condition. They're asking questions and see how they can help. Those are the ones that I always say, okay, you two are going to make it and have a great relationship, because again, your partner should be there to help you, not make it harder. Say you're symptomatic though, you might be forced to disclose earlier. So maybe you developed a crisis or you have some joint pain. You might have the one visible symptom of sickle cell, which is jaundice or the yellowing of the eyes, which occurs as a result of red cells being broken down and bilirubin accumulating. Since we're talking about intimacy, it is possible for sex to trigger a crisis because it's physical stress on your body. So sometimes letting your partner know in advance can help, because then they won't necessarily have to worry during the act of maybe hurting you or if there's any issues. Now, when it comes to actually having the conversation and disclosing, it's very normal to be nervous. And I think a lot of it is related to our prior experiences and how people might have reacted or judged in the past. But I always recommend viewing the situation as a positive. I'm looking for somebody who wants me and will accept me for who I am. And you really want to plan this conversation carefully. You want to be honest, you want to be open, you want to be brief. You definitely don't want to overshare, which is something I always tell my sister. I'm queen of oversharing too. And you kind of want to think about giving information in bite-sized pieces, because if you word vomit and let it all out, then I would even be scared. So when you're thinking about how you want to disclose, start about thinking of the physical effects and do just a little sickle cell 101, like, hey, I have this inherited condition. That means that I inherited an abnormal gene from both of my parents, which causes me to produce abnormal hemoglobin. And in certain situations, like if I'm dehydrated or if I get an infection, my hemoglobin changes into shape and can cause blockage of blood flow, which then causes pain. And I can also see anemia because my hemoglobin has a lifespan of only 10 to 20 days instead of 120 days. You can talk about your triggers, because if going to a beach and going on a party is going to trigger a crisis, let your partner know, hey, certain things like this can trigger crises, because they need to know how they can help. So other crises, obviously dehydration is a big one, emotional stress, physical stress. So this could be overdoing it at the gym, infection. This is why hand hygiene, getting your vaccines, mask wearing. I mean, we're about to start, or we're in a really bad flu season. We're seeing peaks, of cases of RSV and flu very early in the season. So I'm recommending to all of my patients to get their flu vaccine now. And then you also want to think about practical issues, such as what type of impact does this have on a job, on a family, or finances? Now, when it comes to discussing the long-term prognosis, I think this can be harder, and this is something maybe you want to consider looping in your doctor if you don't feel comfortable answering or don't know necessarily how to answer it. And again, I think it goes without saying, social media probably and text messaging isn't the best way to communicate with your partner about your condition, about intimacy. But I think involving your provider is something that can be very helpful to help answer some of those questions that you might not know how to answer. Because overall, the majority of adults living with sickle cell in the United States are going to live into adulthood. But we know that every crisis matters. So I think just knowing how to have that conversation is important. Now, depending what stage you're at in your relationship, discussing inheritance or how a condition is passed on to your child could be mentioned. With regards to sickle cell specifically, sickle cell is an autosomal recessive disorder. So this means you need to receive at least, or not at least, but you receive one abnormal copy from each parent in order to have this gene. If you only get one abnormal copy, that's what sickle cell trait is. Sickle cell trait, it's always, we say it's a benign condition, and for most, you're going to live a life without any issues. For a small subset of population, there are going to be some people who do have crisis, who are at higher risk for different complications. But generally speaking, sickle cell trait shouldn't cause too much interference with life, and it's more just something to be aware of when it comes to family planning, so you know how your genes can interact and potentially be passed on. So if we look at this lovely image, I found this from Sickle Cell 101. If you don't see their Instagram and other accounts, I highly recommend. And I kind of just adapted it. So here at the top, we see two people with sickle cell trait. So with each pregnancy, there's going to be a 25% chance of having a child with sickle cell disease, a 50% chance of having a child with sickle cell trait, and then a 25% chance of having a child unaffected. So again, it's each pregnancy. So yes, it's possible that if you have 3 kids, all 3 kids could have sickle cell. If you look on the right-hand side, this shows a patient who has sickle cell disease, hemoglobin SS, with somebody with normal hemoglobin genotype, which is hemoglobin AA. In this case, all of the children will have sickle cell trait, but none will have sickle cell disease. If you have somebody with sickle cell trait mixing with normal hemoglobin, then you have just a 25% chance of having a child with sickle cell trait, and 75% chance of having normal hemoglobin genotype. And then if you have somebody with sickle cell disease mixed with somebody with sickle cell trait, it would be a 50-50 chance of having either sickle cell disease or sickle cell trait. Now in America, 1 in 12 African Americans have sickle cell traits. 1 in 365 adults, African American adults, have sickle cell disease. And the next closest ethnicity is 1 in 16,000 Hispanics. So it's just a way to advocate for yourself, knowing what your genotype is. So when it comes time to having children, you know what the chances and the likelihood of passing on a condition or even just creating a condition. Because again, you could have sickle cell trait and have a totally normal life, and then all of a sudden find out you have a child with sickle cell, and that's what led to your diagnosis of having sickle cell trait, which is not uncommon at all. So now that we have an idea of what to disclose and when, let's talk about some tips for effective communication. And I think it's really helpful when disclosing and really important when it comes to intimacy, because good communication leads to higher relationship and intimacy satisfaction. So to start, you want to be communicating in a comfortable place. You definitely want to give your full attention, make eye contact. Definitely don't be standing up and staring down at your partner. That could be very intimidating. And something I learned in therapy, which was the most helpful tool that I tell everybody, is using I statements. I feel blank and I need blank. So you could say, when it comes to disclosing, I feel nervous telling you something about me and I need your attention and support. Or when it comes to intimacy, you could say, I feel I need to inform you about our bedroom intimacy. Or if sex triggers a crisis for you, I feel nervous about having intercourse. I need to figure out a way to prevent this. So if you don't know how to ask what you need, you're less likely to have your needs met. So talk about what you need, what you want, what you don't like when it comes to intimacy together. You also want to reflect back to your loved one. And this is a form of effective communication that I learned in nursing school as a way to enhance communication with patients. But in reality, all of these tips are good for any type of dialogue with a person. And it really is just showing that you are engaging and listening to what they're saying. When you reflect back to somebody, you are confirming to that person that you heard that message. It's very powerful. So you could have, if I understand you correctly, I think you're saying X, Y, and Z. So I do recommend, and I use that when I speak to my patients, because I think it just validates a lot what somebody might be experiencing. And then with any communication, active listening is more important than what you're actually saying. So do not interrupt. I'm queen of interrupting. Anybody who listens on here, I genuinely apologize. I get really excited sometimes, and it's something I'm working on. You want to stay focused. Nonverbal communication, such as eye contact, like I mentioned, maybe holding hands. Body language is huge. I mean, when I stand and I talk, I'm just comfortably, I sit with my arms crisscrossed, but I know that this can appear very closed off and even judgmental at times, even though that's never my intention. So I think just being mindful and aware of your body language and how that could interfere or how it could just enhance, maybe if you're holding hands, that conversation is something to consider. Now, as a reminder, intimacy is not only about sex. To be desired, to be valued, loved, it's a universal need, whether you have sickle cell or not. When we talk about Maslow's hierarchy of needs, sex is on the bottom of the pyramid, and it just shows that this is something, sexual health, that we need to consider as part of the whole body. Now, again, talk to your provider. This could be about disclosing your condition, but also related to different medical issues such as priapism, strategies to prevent crises when having sex, or just talking about your condition with your partner in general. So that was my perfect segue to the next section, which will be on reproductive health as it relates to sickle cell. So let's talk about priapism, which is the medical term for a persistent and prolonged painful erection. Big thing, it is not sexually related. I talk about this and I will ask every male patient of mine in the appointment, do you have priapism? Do you know what that is? Because a lot of times, especially adolescents and young adults, might be embarrassed about this and not realize it's related to your sickle cell and not disclose it. And the problem with priapism is if it's left untreated, it can actually lead to infertility. So many times people are concerned about hydroxyurea affecting their fertility potential. This is going to affect your fertility potential more than hydroxyurea would. So when it comes to management, first you say, drink your fluids, maybe walk around. Some of my patients like doing push-ups or squats, and they say that that helps. If it's becoming more regular, you can even try over-the-counter Sudafed. Again, I am not recommending people listening to go take Sudafed, talk to your provider, but these are the general stepwise approach strategies we take to manage priapism. There's something called stuttering priapism where you start having the erection, then it gets better, and then it comes back. And if you're having that stuttering priapism, taking Sudafed over at bedtime consistently for a few nights can sometimes be very helpful. But if you're dealing with recurrent priapism and those strategies, the conservative ones and over-the-counter haven't really helped, that's when you really want to speak to your provider, because then we have prescription medications that we can do, such as terbutaline or even Viagra. I mean, there's more to the blue pill than just helping you have sex. It actually is helpful with priapism as well. And I do have a handful of patients who actually had to get surgical management to help with the issue. So this is fairly common among our males with sickle cell, but it's not commonly addressed. So if anybody is experiencing this, definitely make sure that you speak to your provider, because you are not a unicorn and the only one having this issue, and we have strategies to help you with this. Now switching over to our females, it's not just a bad period. If your period is causing you to have severe pain every single month, you are more than likely having a sickle cell crisis, not just really bad cramping. You can have crisis from just the hormonal shifts as a result of your period, or just from the blood loss in general. So if this is happening every single month, you're having a crisis as a result of your periods, talk to your provider, because this is when we can start talking about contraceptives to address this problem. People with sickle cell are at higher risk for developing blood clots. Estrogen, which is in a combined oral contraceptive pills, it's in the NuvaRing, it's in the patch. Estrogen will increase your risk of blood clots as well. So patients with sickle cell who are going on contraceptives want to be on progesterone-only options. That leaves the progestin pill, that's called the mini pill, but you have to literally take it the same time every single day. Otherwise, you're going to get breakthrough bleeding. There's the Depo-Provera, which is an every 3-month intramuscular injection, which works really well. It's not necessarily something you want to use long-term for like 10, 15 plus years, because it can cause weakening of your bones. But that's a fairly convenient option for every 3 months. And the most common side effect for that is spotting or breakthrough bleeding. But for most, after the first 3 to 6 months, the periods start to regulate, and you end up having no period or very little period at all. So a big thing is really just to understand that risk of developing blood clots and knowing how you can advocate, and just being aware that every month, if you're getting a really bad crisis because of that time of month, to talk to your provider and see how we can help. The other thing is, if you are regularly menstruating and having your cycle every 28 or so days, if you know your period comes this day of the month, you can even start taking naproxen or NSAIDs. Again, speak to your provider and make sure that this is appropriate given your history the day before. And this essentially helps block the prostaglandins, which contribute to a lot of the menstrual cramping. But this can have a huge impact on your quality of life if you're having this many crises. So again, talk to your provider, because I have patients who had at least 12 crises a year, and then we got them controlled on contraceptives, and that's one less crisis that they have to think about. So now let's talk about sickle cell and intimacy and learning to work within your limitations, since again, sexual health really is part of our physical health. So when it comes to having your conversation, it's really important to discuss your insecurities, because at the end of the day, insecurities can lead to sadness and lack of desire. And sexual worries really are best resolved by discussing them with your partner. So you might have limitations due to pain itself. You could have limitations due to the symptoms of anemia, such as feeling tired or short of breath, or just getting totally winded from just one position. You could have issues with regards to your joints affecting mobility and just what positions you can assume. Some people might have ports or scars from surgery or trauma and might be self-conscious about their physical experience. But you really want to discuss your preferences. What are your fears? What are your concerns? What affects your desire and stimulation? Does sex trigger a crisis, or does it relieve it? I did a poll on my Instagram the other day, just trying to gauge the audience and see what's pretty common among the community. And it's pretty 50-50 on having sex trigger versus relieve it. And, you know, when it comes to sexual health, I really was never that open with discussing it until I began having my own issues after my first pregnancy. And I had to go to pelvic physical therapy and do things that I probably never really thought I would do, and talk about things so nonchalant that it just normalized it. And I think when you I was forced to kind of talk about it, but then it made me realize when you approach situations in places of curiosity and interest and just keep it light, it makes having the conversation so much easier. And just from my own personal experience, that open discussion strengthened my relationship with my husband so much. We've been together 15 years, and I would say we're the strongest now than we've ever been, especially in this one department as well. And I think it's because of the openness and just being able to have these open conversations and fun conversations and just figure out what's fun that we can do to keep a relationship alive, because we've been together 15 years. You don't want to get old and get bored with the mundane. Now, for those who have issues with joint health and that's affecting your sexual health, here's just different tips and strategies you can think of, such as supporting your joints with pillows or blankets. Figure out what your problem joints are. So we know patients with sickle cell, a problem which is usually the #1 cause of chronic pain, is avascular necrosis. So we know anywhere blood travels, sickle cell can affect. So one of the places blood travels is your bone. So say you have blocked blood flow or decreased blood flow to a bone, and say you just like lightly tap right here and it causes significant pain, that's a bone infarct, and that's decreased blood flow or no blood flow to the bone. Anti-inflammatories work really well, heat therapy, etc. But if you have repeated bone infarcts over time, that can then lead to you progressing avascular necrosis. And once you have a vascular necrosis, you can't reverse it. You just want to prevent it from progressing. So ways you can do that is, depending on the joint that's affected, hydroxyurea is a big one, because the higher level of fetal hemoglobin, the slower the onset and the delay of progression of avascular necrosis. If you have AVN of your hips, knees, or ankles, it's really important to just think about weight management, because any additional pounds is putting extra pressure on those joints. But when it comes to sexual health, if you have avascular necrosis of your elbows over your shoulders, for example, doing missionary position and being on top is putting a lot of pressure. And in the upcoming slides, I do have some images. They're not real images, so nobody get too excited there. But anybody who is under 18, please just put your earmuffs and eye muffs on for the next couple slides. And then you'll be able to see some pressure points depending on the positions. So here on the left, we can look at missionary position, and you can see on the images the asterisks which highlight which joints are most predominantly affected. So when we look at missionary position, you can see the elbow and the hip, and I should have put shoulder since I just mentioned it, are high pressure points. So if these are problematic joints for you, definitely not the position for you. Looking at cowgirl, it's pretty safe for the person who is on bottom. However, for females, you can see the knees and the hips can be a little bit more problematic. 2 more positions to review would be just kneeling. You can see puts a lot of strain. So a lot of these I feel like might be common sense, but at the same time, not something that we are thinking about all of the time. So I kind of feel like including the images just helps give you a visualization of how we're putting stress on our joints and how we can just mitigate that if we do have joint issues. So as a reminder, again, intercourse and sex, it is a physical stress on your body, which can trigger a crisis. So here are other considerations that can be made to just try to make this as fun as possible and not negatively impact your health. So you want to time intercourse when you're feeling best. I mean, do you have less pain in the morning? Do you have most of your energy at that time? Maybe consider taking a warm shower either before or even afterwards to help relax your joints. I have some patients that medicate before having intercourse. When you take oral medication, it takes usually up to an hour for it to take effect. It's a noticeable effect, I should say. So sometimes taking it 30 minutes before, if sex consistently is triggering crises for you, is something to consider. During the act, you want to take slow, deep breaths. You want to pace yourself and really listen to your body. And then the last thing I did want to recommend is couples counseling, because over time, the dynamic of a relationship can change when somebody is living with chronic illness. And I think in order to prevent any type of burden or resentment or negative impact on your relationship, being proactive with couples counseling can help kind of clue into different potential issues and how to best navigate them without negatively compromising your relationship. And then last, intimacy does not always mean sex. We can talk about being sensual in addition to intercourse. So here are just some examples. Instead of Netflix and chill, we can do a little Netflix and snuggling. We can do massage. I mean, I don't know about you guys, but anytime I have a massage, I feel like they're always trying to progress it in a different direction, but it doesn't always have to go that route. Holding hands, using your words, sharing a shower or a bubble bath together. And then they have a lot of fun games that if you ever want to just get to know each other and get to know on a deeper level once the kids are asleep, I think you might learn something new about your partner and about yourself and have a little fun with it. So that is really the end of my presentation. And I just want to end the conversation by stressing the importance of having effective communication. At the end of the day, the difficult and the uncomfortable conversations need to be had, whether it's regards to sexual health or racism or stigmatization. We need to have these tough conversations. An issue will never just work itself out if it's being avoided and not being discussed. And I think a lot of the times this stems from childhood, where we see our parents avoiding conversations or denying certain issues, or we just expect our partner to be a mind reader and be on the same page. But we can't be on the same page without consistent and effective communication. So I would love to open up the floor for any questions, or Ray, if you want to hop back on, we can have a little dialogue.
Thank you so much. Oh, Maya, I always enjoy listening to you. Now, I'm going to give my age a little bit. So I don't know if anybody remembers Dr. Ruth, but you are like the modern day Dr. Ruth for sickle cell. If you all don't know who that is, just go ahead and Google her. You will see she is a riot, but she was like the sex guru of the 70s and 80s. And she was talking about things that were necessary, but no one was talking about. The topics that you've brought up, having spent, I don't know, almost 7 years in the clinical setting, there were so many times that these conversations were needed. And I saw a lot of struggle on both sides, right? It wasn't just patients who were having a hard time talking about it, but it was actually providers who were having a hard time bringing it up. Why do you think that is?
I think it all boils down to your own comfort level. I mean, I had no filter. My parents had no filter growing up. So I think just my childhood and exposure talking about penises and all of that was totally normal. I mean, my dad was an infertility specialist, and I had my first sex talk when I was 8 years old with him coming in. Do you know what gonorrhea is? I'm like, no, it's gonorrhea. So I think my upbringing is very different than the norm, and probably has increased my comfort level for the topic in general. But then just personal experiences have helped on my own fronts. But I think it's just provider comfort level. And for some, if you're not open about it with your own partner, how are you going to have these type of conversations with, I don't want to say a patient is a stranger, but people who you're not necessarily as close and connected to in general? Well,
you know, I think that you're right on. You hit the nail on the head. It is about that comfort level. And I also think that it's about self-empowerment, right? When those topics are being discussed openly, and there's no shame and there's no embarrassment, and, you know, there's no unnecessary narrative that goes with it, you can feel a lot more comfortable because it's your body. And whether you're talking to your provider or you're talking to your partner, the value of being able to have that open conversation also reassures you that you're with the right person, right? Yeah. You should be able to talk to your provider about this. I'm not saying it's not going to be uncomfortable, because it's the topic itself, you know, kind of, it just, you kind of got to get your feet wet and then kind of wade in the water a little bit, but you shouldn't be ashamed.
Exactly.
To talk about it. So I agree. And I'm like you, when my son came home after having the sex talk at school, I'm like, yeah, but did they show you pictures of what it looks like? So he's like, I'm sitting here Googling pictures of, you know, gonorrhea and all the, and he's like, really, Mom, really? I'm just letting you know the full story.
God, it wasn't just us. I was like so excited. All of a sudden I'm like getting slides. I'm like, not what I was expecting. But I think it is true with regards to just being very, like, anytime I speak about things with patients, I'm very matter of fact. And I think this is where using medical terminology and not using child names or just little makeup names for our private parts, and using medical terminology and the actual anatomical name for the penile shaft and penis, etc. It removes that layer of just being embarrassed, because we're medical professionals. This is what we do. I'll validate. I'll be like, hey, I get it. This is weird, especially if I have somebody who's 19 years old and they're talking to me about priapism and their penis issues. I mean, I can understand how that can be uncomfortable, but I think just our demeanor and just talking about it so casually and calmly, like this is just another conversation about coffee. I mean, whatever it is.
Well, I love, you know, one of the points that you made, and I know I'm probably prolonging the priapism, no particular reason, but part of it that is because it's rarely talked about openly. And that's me being the mother of a 26-year-old. warrior, it's something that we've always talked about. I know kids as young as 6 years old who started having priapisms. And what I worry about is by feeling that shame and not talking about it, you could be having more complications than you have to. You could have long-term damage. And I don't want anyone to have that because they didn't feel comfortable talking about it. So I love that you are openly talking about it and you're comfortable doing it.
And for caregivers too, I think it's important to know that this is a symptom, because I did have I don't want to say it was an issue, it's more of a teaching opportunity to speak to the patient's mother, because she didn't understand this was a new symptom for him that had just started. It ended up being the result of a medication. So he's in his 20s and all of a sudden he's waking up in the middle of the night, and the mom thought that something else was happening. And I had to kind of just explain, like, no, this is a medical condition. Yes, he went his whole life without having this, but kind of teaching that point. So I think for patients and caregivers, it's definitely a good way to advocate.
I agree. And you saying that about talking to the caregiver, I think it also brings up, about, incontinence and bedwetting. That is very normal for kids and preteens and sometimes even into adolescence to have that because of urine concentration issues. So we have to talk about these things. These are your body. These things it's all related to your body, and we want quality of life also includes body functions. And so we want you to have that.
No, that's such a good point, because I did a post, like a did you know about nocturnal aneurysms, which is the medical term for bedwetting. And the comments that I received for that post, I was so happy I did the post, but it was just saddening because so many people are like, I wish I knew this growing up because I used to be punished for this. And it's just, this is part of your condition and it's so normal. And I'm sure people listening in, how many adults are you waking up in the middle of the night to pee? That's called nocturia. And I think it's over 90% of adults with sickle cell have this because, like you said, you don't concentrate your urine as much. So just normalizing and just realizing that you aren't your own unicorn having an issue is very empowering.
And I learned the hard way, right? I was one of those parents that are like, no, you can't have any more water. You're gonna pee in the bed and then I got to get up in the middle of the night. So all of these issues. One of the things I cannot wrap my head around, and I know it's probably going to be a question and then we're going to move on past priapism, but the blue pill, how is it that a pill that you take to get an erection actually helps you control erections?
Because it causes dilation of the vessel. So it's just helping increase blood flow.
Got it.
But that's one of my fun facts. Like there's more to the blue pill than just. But it's harder because it's an off-label use. So anytime I do, usually I'll prescribe Cialis over Viagra because it lasts longer in the system and whatnot. But it's more challenging from an insurance standpoint because it's an off-label use. And that's usually most of the prescriptions are off-label for priapism anyway. So lucky me, I get to deal with the insurances, but that's definitely after you failed. Usually we'll do terbutaline, then Proscar, and then if needed, we'll go to Cialis.
Okay, so if anybody's listening and that's something that you're interested in, rewind a few seconds, listen to it again, write it down. Okay. So the other question that I have is estrogen. You talked about estrogen with menstruation and taking birth control. How is that related to blood clots? Why does it increase blood clots? And many of us have known this for a very long time about, being very careful what kind of birth control you're prescribed if you have sickle cell disease. But I'm curious, why the increase in blood clots?
It's just the mechanism of, it's the same thing like when you're pregnant, for example, the increased blood circulation of estrogen and progesterone will increase your risk for blood clots. Progesterone does not increase your risk, but estrogen is just the physiologic effects in your body does increase your risk of developing clots. And we know sickle cell is technically a hypercoagulable state or a state where you're at increased risk for blood clots as well. I have patients who do get put on COC, which is combined oral contraceptives, and they are on both an estrogen and progesterone containing pill, and they're not having blood clots. But my opinion is if you know you have a condition that can increase your risk for clots, I'm proactive with my approach when it comes to medicine. I don't like to be reactive and then switch it after you have an issue. So I think just knowing that both of them increase your risk, then let's choose a safer option that's going to essentially accomplish the same thing. I had one of my female patients who she's a lesbian and she goes to the gynecologist asking for contraceptives. And the doctor was like, I don't understand why you need this if you're not sexually active. And it just made me realize that I need to just make my convey my communication, because she wasn't able to fully express why she needed it, that we were putting her on contraceptives more because she's getting severe monthly crises because of the heavy blood flow, not necessarily for the contraceptive options. So I think those type of experience just helped me frame my conversations a little better too.
Well, I'm just glad that we're talking about it. I think that not only am I grateful that we're talking about it because it empowers the sickle cell community, but I also think it informs particularly primary care, right? Because I want all of my warriors to have primary care, not just a hematologist, but I also want primary care to know what some of the complications and risks are. So if you may not talk to your hematologist about priapism or about, bad cramps or, birth control needs, but you may talk to your primary care provider, and we want to make sure that they're aware of those risks as well. So that's really good to know. I'm also glad that there are more and more providers who are talking about severe cramps and having a pattern of these severe cramps, having a pattern of these crises at the time of your cramp, at the time of your menstruation. Sure. There were many years that there was kind of a pushback against the fact that could have been a crisis. There's more I could say about that because of, how many, it's a very male dominated environment. And so there just may not be full understanding in some cases. And in other cases, I just think more studies have been done, right? That's the great thing about medical science. And so continue talking about these things. I think it's so important. I do see that one of our guests who are with us live asked a question. I think it's a really good question. Very good presentation, as always. I've always been upfront on my status as a sickle cell warrior. However, lately, personally, with me being open about it, I think the other parties don't necessarily want to go ahead with the progression of the relationship. So how would you encourage the warrior that's longing to find a nurturing partner? Because what we're talking about is fear. I don't think it's a lack of love. I think it's an overabundance of fear, right? So What would be some of your recommendations?
So I would start, and I'm wondering, are you leading with your sickle cell? Is this something you're having in the first date type of conversation, or is this something after a few dates? So I would just be your normal self and just go on the first few dates. And once there's some substance and you realize there's something more, then start to be like, hey, I just want you to know I do have a condition called sickle cell. And since I know who asked the question, your sickle cell is very well controlled, and you are very well managed from a sickle cell standpoint. So I would lead and reassure from that standpoint. And again, if they're not open to it, and unfortunately it does lead to the end of a relationship, they're not the right one. We shouldn't have to force relationships. And I think it's really hard because when you want it, and then you just see everybody around you having it. It's like, I remember when I wanted to get engaged, like literally everybody around me was getting engaged. I'm like, why can't I get engaged? And then it's like, I wanted to have kids, and then everybody around me is having. I think when it comes to relationships, you have to take your time with it. And I would say, try not to search. I feel like relationships always happen and you find the right person when you're least looking for it. And I would try to just be yourself, because you're literally the most positive and nicest person. Like Dr. Harrington and I always say, when you leave our clinic, it's just a breath of fresh air, is that you are such a bright person that I know when you find the right person, it'll just connect and it'll make sense. I really don't think you're doing anything wrong unless you're leading with it on the first date. I would say maybe wait a few dates once things get serious and then open it up. And if you don't know how to answer it, you can always email me, and I'm happy to have a conversation with any of my patients' partners.
That's such a great response. And yet at the same time, being a boy mom, like he's a man mom. I'm a man mom now.
Yeah, 26.
But I can understand that. I can understand how wanting to have a relationship, wanting to share that love, right? The older you get, you realize the value of loving and being loved. And just wanting to find that, but wanting to find that in the healthiest of ways, right? And so to your point, it shouldn't be forced. It should really happen kind of naturally. And it doesn't mean it won't be a bit of a roller coaster, but you'll be open and comfortable. And those are some of the best relationships I've seen in my 50 years. So
and it's just easy. I feel like when you get in and then once you get that easy relationship, you look back on all of the other ones, and it's just like, it'll make sense.
Oh, yes. Oh, yeah. You're like, yeah, that's why that didn't work out. Awesome. So when, I think about those parents who have children, and they need to have these kind of conversations. I don't want warriors to wait until they're adults to think about their sexual health. How do you encourage caregivers of adolescents, preteens even, to begin having this conversation so that you have this open relationship where you don't have to fear having that conversation with your kids?
Well, I think this is where having different foundations like yourself and different chapters where you connect with other warriors who are similar age is so powerful, because you just connect with them. You already have that commonality that you both have sickle cell, and then you just talk and you compare symptoms and what you've experienced. And then you realize, hey, you have this problem too. And then you realize, okay, this is my sickle cell, I can talk to it. So I think parents can do a lot, but at the end of the day, if you're not open and receptive to what your parents have to say, you're not going to have effective communication. So I think having your children connect with like peers who have sickle cell is something that I've seen be so powerful and really help shed light on different issues. And I love when a patient will bring up an issue, and a lot of times I'll just out of curiosity, like, oh, like what made you think of that? If it's something unexpected, and they'll say, oh, I talked to a warrior, even somebody just on like Facebook groups, not necessarily live interactions, and I was wondering about this. So I think those connections are really powerful, and again, very validating, because you realize you're not the only one experiencing, and they've walked this path already too. So they might be able to give you other advice on how to navigate high school and different issues that you definitely don't want to talk to your parents about.
No, I think that's really, really important that you give your kids a community to belong to. Right. I think we all need this sense of belonging. If you've been in this community long enough, that isolation tries to creep in. And some of that is from the lack of belonging to this bigger community, and not getting tired of explaining over and over. But also, as a caregiver myself, I think connecting to other caregivers is really important as well, because you can talk about the hard stuff between one another. I love support groups. I prefer to call them empowerment groups, but because if you have a good led facilitation over conversations, you can bring these kind of things up and kind of allow people this safe space to talk about what are their fears and challenges related to having that conversation in their own home.
And I'm glad you mentioned the caregivers, because I feel like all too often we focus on the person affected with sickle cell. But when we talk about caregivers and you look at the statistics and the rates of depression and mental health, and just, I don't like saying caregiver burnout, but you can have compassion fatigue from and the isolation. We think isolation for the person affected, but for the family and the caregivers as well, it's a lot. So caregivers to those support groups, I think, are even more empowering for sure. You can speak to it more than me. Yeah.
I mean, when I had my son in 1996, the internet didn't look the way it did. It had a green background for those of y'all, and you dialed up, and
the dial tone,
it was a lot. But we didn't know what we didn't know, and we didn't have the resources to know, in the same way. And so we made some mistakes that now I think that many of us who are in the advocacy space, who are family members of warriors, are able to speak from this lived experience, and the importance of that healthy start, and embracing, your child in all of who they are, their whole person, not disabling them, not putting them in a bubble, allowing them to live. And though the things that you have to be mindful of, just simply letting them have a childhood, right, is so important. And the value of that, when it's time for transition, really shows up. You'll see all of those strengths show up in such a great way when it's time to transition, and as they begin to navigate their care throughout the adult system. So I am so grateful.
Since you talked about transition, I just want to put my 2 cents in, because we know when it comes to that transition period, there's a spike in mortality rate between 18 and 34 years old. There's a lot of reasons for that. But I think just knowing that statistic as a caregiver, involving your patient, sorry, you're talking, my medical hat is on, but involving your child in the care. And because I'll have patients who have transitions and I'll ask them what their genotype is and they don't know what that is. They look at me like, I have sickle cell. I'm like, okay, now I know where we're starting from. But knowing your genotype, knowing what your triggers are, knowing what medication you take, what works for your pain, and involving them in early, like even as early as 12 years old, as soon as they show some type of interest. If I was a caregiver for someone with chronic illness, that's something I would totally recommend, because I think that's just empowering them and enabling them to have a more successful transition once they get to the adult side.
I agree. My son tells me now, like I said, he's 26. Now he's like, you don't have to say that, Mom. Your voice is in my head. It doesn't leave.
Great. Good job.
That's what I said.
Get an award. That's awesome.
Sounds like I did something right.
Yes.
So that's okay. It means you've done something right. And we are one big community. At Sickle Cell Foundation of Minnesota, I really try to change the narrative to say, we are one big community. We may have different villages within that community. Obviously, you have the patient, you have the caregiver, you have providers, you have educators, but anyone who touches the lives of individuals with sickle cell and impacts their outcomes, I believe is part of this community, because it's a lot better to say, it's a lot better to be in the house trying to help everyone than being out of the house and just watching the house burn and running around looking for water, right? It's when you're part of the community, the way that you identify solutions, and it looks very, very different. Totally. So I appreciate you being a part of this community. We appreciate everything that you are doing, both in the clinical setting, but actually out in the community as well. I encourage people, like, get on Twitter, get on TikTok, get on all of those mediums, because that's where they're at. That's where our community is. And what it takes to reach them is going to be an out of the box way of thinking. And it's important that that we lean in towards them. They don't just lean in towards us. And so we can do this together, and we learn from individuals living with sickle cell disease of all ages. It's amazing the things I learned from small kids all the way up to older adults. I have a 70-year-old that I talk to and I ask questions of, and she is just, the things I learned from her. I learned in 2019, what's this year, 2022? The pandemic ruined it for all of us.
I know, it's a blur.
But I learned that my own grandmother had a sibling with sickle cell disease, but she couldn't talk about it because of the pain she felt having watched him grow up and not being able to help. There's so many more people that are part of this community that just haven't found the words, right?
And also in different cultures. I mean, when I connected, the Instagram has been amazing because I've been able to connect to warriors worldwide. And unfortunately, it's made me realize that the stigmatization and the mistreatment, unfortunately, is a worldwide issue. It's not just exclusive to the United States, which it shouldn't be exclusive anywhere, but the fact it's a worldwide issue is very upsetting. But when I was speaking to people who are in sub-Saharan Africa and the areas that have the highest rates, they have this perception that sickle cell is a curse. And
absolutely. Yes.
That is just, when I learned of that, I was just kind of doing like a casual interview. I'm just like reaching out, trying to like get more information, because I'm like, how can people think this is a curse? It's literally a genetic condition. It's not like you chose to have it. And it's so upsetting too, because I just can't even think about the mental impact that has on the parents, on the child who has sickle cell, who was born into this world without even having a choice. And I think just that aspect of being able to speak up and say that I have sickle cell and not be ashamed of it. I can't wait until we're at a day where worldwide people have that confidence and don't feel like they're going to be judged when they make that comment.
And you know what? I'm going to go a step further. I will be glad when people can say, I have sickle cell trait. And I know what that means, because what I say is undereducation is miseducation. If you're not giving people the information that they need to better understand something, you are oftentimes left to come up with your own explanations. And that's always going to lean towards what feels most comfortable or what is culturally acceptable. And that's where we get into miseducation, right? And so I believe that we have to be talking about sickle cell trait so that we can normalize that conversation, so that when we see disease, we understand the nature of it and we understand how it's passed along and the genetics of it. And I think that, and my hope and prayer is that by approaching it through the trait conversation, maybe, just maybe, we can bring greater empathy and understanding to this genetic condition. It's not a Black condition. It's not, it's not a curse. It's not all these things that this narrative has given it. But like so many other conditions that are genetic, this is what happens if we're not talking about it and we're not talking to each other. So this is how we do
progress. We're making progress. I mean,
exactly. I've
been here for 8 years, and I would say in the last like 3, 4, 5 years is when there's been so much more of an interest from a sickle cell standpoint. And there's so many clinical trials underway. We have obviously gene editing, which is going to be that promising cure of the future, but we're going to have so many other treatments along the way that are just going to help improve the quality of life of individuals living with sickle cell, that there's so much more interest and there is more funding than there was, and we're going to continue to see that. And I don't want to say it's exciting to have sickle cell, but this is an exciting time because there really is so much research, and the landscape of sickle cell is going towards individualization. Where I started, I only had hydroxyurea and blood transfusions to offer patients, and now I'm able to offer combination therapies, and I'll continue to be able to really individualize treatment plans for a specific need, because I feel like we haven't really had that option in the past, and some providers just put everyone on Hydrea, that it'll be nice having options.
And I think that's the key, is being able to have options. 26 years ago, this was not the conversation that I had with my son's doctors. And so to your point, this is an exciting time in benign hematology. I don't know why they call it benign.
I know we say
for the life of me,
because there's nothing benign about it.
There's nothing benign about it.
Non-malignant.
But yeah, that's true. But no, this is very exciting, and people are talking about it. Not only are they talking about sickle cell disease, but they're also talking about it alongside health equity. Yes. And so, sickle cell disease is the intersection of the ills of our society. And so, when talking about health equity, when talking about social justice, when talking about, educational justice and all of these other pieces, sickle cell disease, there's elements of that within this community. So, I love that. I think that we are embarking upon a time where there will be so many more people openly talking about it, both people who have the condition, people who are a partner of someone, as well as providers. And that's what's exciting. ASH, American Society of Hematology, is coming up next month. I hope to see you there, Maya. And I am excited to be able to do some recording so that I can hopefully share this experience with others. In the meantime, Ray can talk forever when it comes to sickle cell, so I will stop myself now. But I do want to make sure that I remind people that this session, for those of you who are watching live, this session will be available in about 24 hours on our YouTube channel. So you can visit our YouTube at bit.ly, SickleCellMN-YouTube, right there on our screen. And then also, move our station. Of course, we always want to say thank you to TheHemeNP, who can also be found on Instagram, Twitter, TikTok, all the fun ones. I encourage you, if you're not already following her, whether you're watching live or watching a replay, pause the video, go ahead and go over to the social media, click follow, and then come back and watch the rest of the video. But we are so grateful for you coming on all the way to cold Minnesota, where it snowed today. And I'm thinking about you in your sunshine.
I won't tell you about our temperature was, because it was
my gosh. No, please don't. I was tempted to almost Google your temperature, but I couldn't do it. I've been out 3 times to snow just today. To shovel. If you're looking for other SickleSMART sessions, our educational repository is part of our YouTube channel, and you can see some of the other, we actually are up to like 60 or so videos at this point. I love it. I'm excited about what's going to come, but check us out. Go to our Eventbrite channel. That way you can be notified whenever we put a new video, a new session up, so that you can register in advance. And then I never miss an opportunity to encourage people to donate blood. I'm not talking to people living with sickle cell disease. I'm talking to the people without it, because we're here to help when you need a transfusion to make sure blood is available. And so if you really want to lend a hand, I'm asking you to lend an arm. There's always a blood shortage, but particularly for the sickle cell population, we need you. If you'd like to learn more about why Black blood matters and donor diversity really does matter, we have a session for that. You know, they say we have an app for that. We have a session for that. And you can find that on our YouTube channel as well. And then last but not least, well, I shouldn't say that because I got 2 more slides. Joining the Be the Match registry. If you're a person living with sickle cell disease, or you know someone, or you just have a caring heart, encourage yourself, your friends, your family to join the registry. The same way that Black blood matters and the diversity of the blood supply, the diversity of the stem cells and diversity of the registry for Be the Match is also very, very important to curing, providing a cure to some people with sickle cell disease. If you'd like to learn more about what the bone marrow transplant and other curative therapies are about, and ways that you can be supported through that potential journey, you can go to sicklecellconnect.com, and they've got some information for you as well through Be the Match. And then feel free to join us, our monthly support group. God bless you. Our monthly support group is on the last Thursday of the month at 6 p.m. We have monthly SickleSMART sessions, of course. Now, this is my last slide. We invite you, no matter where you're at, we want you to let your voice matter. So we have a form that you can fill out that tells us about your experiences with the healthcare system. Now, I'll tell you, we want your positive experiences and your not so positive experiences. We want to know, where are they doing great at? But where are they doing not so great out, so that we can continue to advocate for outcomes, improving outcomes in our warrior community and improving quality of life. So you can go to our bit.ly at Our Voice Matters Too, and we hope to hear from you. And other than that, thank you so much, Maya. We actually got it recorded, and so we are going to upload it so that other people can enjoy this wonderful presentation. Anything to add before we go?
No, it's just always such a pleasure speaking with you. So thanks for having me. I hope everybody learns a little bit, and I hope we get to connect again soon.
Thank you so very much. I love it. And we will see you all next time. Take care.
Bye.